Hello and welcome to episode 159. This one of you may have noticed from the title is a cancer update. Today we're just going to talk about cancer because my results are in from my CT scan and my blood results. So we'll talk about my bonus life in another episode. This one is all about cancer. I'm going to sit over to the side because we're going to use this left hand frame. I think for you it's a right hand frame, quite a bit for some of the pop-ups I'm going to do. So here's today's agenda. And as you can see, the first thing is Sarah Pogg's t-shirt. Same t-shirt I was wearing last week. I have washed it, yes, which is be kind and make good choices. Now, one of the subscribers commented that they lamented the fact that they should have bought it while they could, but you can no longer get them. I just want to let you know that's actually not true. The Pog merch shop does still exist. I'm going to post a link to it down below. And let's remember that while Sarah has passed away, her message has not. And that's kind of the point, which is that being kind and making good choices was Sarah's gift to the world for us to remember that. And it lives on beyond her lifetime. So do feel free to get over to the merch website and buy one. I haven't spoken to Josh Pogg for a while. He and I used to talk fairly often. I used to also talk with his brother-in-law and also Teresa, his sister. Oh, sorry, Sarah's sister. But I haven't for a while. But I'm sure they're doing great. Last I checked with Josh, he's doing well with his family, and he has met up with a woman who has children that have cancer as well. So they've got a bit of a blended family thing going, which, you need to remember that they need to get on with their life. And I think it's no disrespect to Sarah at all. In fact, I dare say it's what Sarah would have wanted for her children and for her husband. So, I'm cool with it, and I hope you are too. Okay, let's go on to my blood results. So I've got the results back. So the first one, I'll pop up on the side of the screen there, is B12. So let's start with my result from November 5, which was 3 months after my operation. My B12 there was 240. Now, if we look at my result from the 11th of February, so that was 6 months after the operation, it had gone up to 300. So now I've got two results that are within the normal range. And just to let you know, that first result was just me eating my normal diet. The second one was me occasionally, not every day, but occasionally using this B12 spray that you spray under your tongue. I wasn't using it every day. I would just do it very occasionally. And that is at least partly explains the rise in my B12 number. I think part of it is just my intestines settling down. What it does show is that I have enough left of my terminal ileum that I am still able to synthesize B12 through my gut. And actually, I don't need supplements. I am within the normal range, even if I don't take supplements. I do have enough of my small intestine left. So that's great news. And I'm going to say to the doctors, I don't think we need to track B12 anymore. I'm satisfied that if I eat a normal diet, then I'm fine. The second one is GFR, or estimated GFR. Now, I didn't know what this is, so let me firstly give you the definition, and then I'll show you the results. So the definition of GFR, just waiting for it to come up on my screen, is, here you go, and I'll pop it on the screen for you as well. The glomerular filtration rate, or GFR test, measures how well your kidneys filter blood. It's a blood test that estimates how much blood passes through the tiny filters in your kidney each minute. And a GFR of 60 or more is considered normal. A GFR of less than 60 for 3 months or more could indicate kidney disease. A GFR of 15 or less would indicate kidney failure. Now, I'm consistently showing a GFR of over 90, which means my kidneys are functioning normally, although I do wonder why, and now we'll go to my results. Oh, sorry, I'll give my results. So on November 5, there's my result from November 5, and the estimated GFR is over 90. And if we go to the one from February 11, you'll see it is also greater than 90. I find it odd that the pathology lab felt the need to write the comment underneath though. Estimated GFR by CKD EPI algorithm uses creatine, sex and patient age only. eGFR is only applicable to patients with a stable medical condition. With stable medical conditions, may not always be appropriate for drug dosing and does not apply to pregnant females, children, advanced age, extremes of weight, or patients on dialysis. So I don't know what to make of that, except to say that my kidneys are operating faster than, well, they're within the normal range, and they're actually more than 50% above being in the normal range. I don't know whether having my kidneys filtering that fast is bad, but I assume they would have told me that if it was. So it sounds like we don't particularly need to keep an eye on eGFR anymore. So looks like my kidneys are quite good. Now back to the agenda. The next one is vitamin D. Okay, so I'll pop up here the result from November 5, and you'll see the result there was 34, and that is below the below what is considered a normal range. So the normal range is 50 or more, and you can see I've got a flag there set for low. Now that result was with me just having my normal diet, having no supplements whatsoever. And my doctor recommended that I did go on supplements. So I did. I went on this supplement here, and you'll notice it's 5,000 IUs per capsule. I started taking 2 per day now, which is 10,000 per day. I didn't realise, I don't know why, because it's written on the back of the pack, 5,000 units is 625% of your daily intake. So that's basically 6.25 times what you need what you need, and I was taking twice that. So I was taking 12.5 times what I needed to take. And let's have a look and see what that had done by the time we get to February 5. So back to it had gone to 160. There you go. So 3 times what is considered normal. So it had skyrocketed up. But the good news is I felt no ill effects of taking such a large amount of vitamin D. In fact, you might remember that on some of my previous videos, I said that from the very first day that I started taking vitamin D supplements, I started feeling better. And I still say that, stand by that statement. I felt better from the first day I started taking it. And perhaps in retrospect, knowing what I know now, for the first couple of weeks, maybe I would have taken 10,000 a day. But from about week 3 onwards, I would have taken 1 a day. And from about week 5 onwards, I would have taken 1 every 2 days. I definitely overdid that, but it doesn't seem to have done me any harm. Looking at this recommendation that I found on the internet to do with vitamin D limits. So the question is, how much is too much vitamin D per day? And the answer, according to artificial intelligence, by the way, is 4,000 IU per day. Some people may need a higher dose. However, including those with bone health disorder and those with a condition that interferes with absorption of vitamin D or calcium, says Dr. Manson. Unless your doctor recommends it, avoid taking more than 4,000 IU per day, which is considered the safe upper limit. So I'm effective immediately. I'm going to go into 1 tablet every 2 days. So I'm going to take 5,000 every 2 days, which is 2,500 every day. So I'm going to stick within that range, given that I am now within the healthy limit. I must admit, this is the first time in my life I've ever had to deal with a vitamin D deficiency. Up until my cancer diagnosis, I was getting out in the sun, I thought enough. I wasn't testing my vitamin D levels, but I felt like I was getting out in the sun enough. But since getting sick and being inside so much and being in bed, not in the sun for very long periods of time, I had to look at this differently, and I ended up getting low and then getting on the tablets, and now arguably I'm high. But now I understand the situation better, and I definitely do feel better for having sorted that out. So if you're not getting out in the sun, and particularly if you're not getting in the sun and you've been tested, these tablets are great. You definitely don't need to go. They do actually sell these in a 10,000 IU single tablet. This wasn't the biggest tablet I could have bought. I would say there's actually really no place in the market for those 10,000 tablets. These 5,000 would be the biggest I think humans need to consume. So yeah, sort it out if you've got a low vitamin D deficiency. I feel a lot better now that I've sorted out mine. Now I'll go back to the agenda. I think it's time for the big news. Okay, tumour markers. Now just letting you know, I've already looked at these. I'm not going to do what I did last time and capture on camera my first view of them I didn't, I've looked, okay? So here we go. So here's the November 5 numbers, which you might remember. So on November 5 last year, my CEA was 1 and my CA19-9 was 12. Going to February 11 this year, my CEA is still 1 and my CA19-9 has gone down from 12 to 10. So I am absolutely without any markers in my blood that indicate cancer anywhere in my body. So that is obviously fantastic news. And it's a full credit to Professor David Morris and the team at St George Hospital, who I will be sending a thank you card to. Actually, I might wait until the 24-month anniversary, because that's when some other professionals were saying, I will definitely have passed away by. So yeah, or maybe I'll send him two thank you cards, who knows. But anyway, I have no evidence of disease in my blood, and that's not just for the PMP cancer, that's any cancer as far as I'm aware. So that is just great news. So let's go on to the CT results, although based on the blood, you should have a bit of a clue as to what the CT results say. So let me read this out to you, and I'll pop it up on the screen. It's kind of a massive report, so I might have to do some video gymnastics to show this graphic, but let's just have a go and see how we go. All right, the results read: mild biapical pleural parenchymal scarring, stable bibasal atelectatic changes, left is greater than right, no pulmonary nodule, mass, or focus of consolidation, no hilar, mediastinal, or axillary lymphadenopathy, no pleural or periocardial effusion. Whew, good, because I do not like pleural effusions. I've had two and I hated them. No central pulmonary embolus. Oh, hang on, maybe that was what I had, a pulmonary embolus, not a pleural effusion. Patent central tracheobronchial tree. Right apial subsolid nodule is stable. So few things there. That's the first time they've ever mentioned that my lungs are scarred. And funnily enough, when the doctor rang this result through to me, the doctor didn't mention that at all, which I thought was interesting. The other thing I want to make, particularly people that are watching this because they have PMP, make you aware of is I went into this with an abdominal cancer, but really healthy lungs. I've come out of it, hopefully with the cancer gone, but my lungs are now damaged in multiple ways. I've got this scarring that they talk about, and I've also got this bibasal atelectatic changes, which basically means the very base of my lungs are still partially collapsed. And that's, I'm told, is because I've had two operations that were very, very long. One was 13.5 hours and the other was 13 hours. And you're on a breathing machine, but the breathing machine is only shallow breathing you. It's only inflating your lungs a bit and then deflating them, and inflating them a bit and deflating them. What it's not doing is blowing your lungs up all of the way and breathing you out all of the way. And what happens after 13.5 hours is your lungs, the bases of your lungs end up collapsed, and it can be quite hard for you to get that back. I think if you were young and active, particularly if you're young and active before and after your operation, your lungs are going to recover after a month or two. If you're like me and you didn't really do all that much athletic stuff before the operation and you definitely haven't done anything athletic afterwards, you may end up with a permanent partial collapse of your lungs. So I've now got lungs that aren't perfect, and I actually went into this with lungs that were perfect. So that's something to be aware of. Okay, reading on in the report, there is a well-circumscribed right thyroid lobe circular hypodensity, 80 HU, measuring 4 millimeters by 4 millimeters in the axial plane, not previously seen on prior surveillance scans. Now, the doctor that rang the results through to me did indicate this. Basically, they scanned from here to the base of my pelvis, and just on the edge of the scan, in an area that technically they weren't meant to scan, they could just see my thyroid gland. The thyroid gland sits here, and they could just see a lesion on the side of it, just on the edge of the CT scan. And that's why it wasn't on the prior scans. And I've looked it up, and it's in all likelihood, it's going to be a benign cyst that heaps of people get, but I am going to be having an ultrasound to have a look at it. Now, down in the abdomen and pelvis, multiple intra-abdominal surgical clips in keeping with a known history of prior peritonectomy, splenectomy, and cholecystectomy. Anastomotic sutures in the left para-umbilical region in keeping with an end colostomy following previous partial colectomy. Unremarkable appearance of the remaining image small and large bowel. So that's great. Just in case you're getting confused with the word unremarkable, unremarkable is a great word to hear on these types of reports. What it means is I looked at it and there was nothing that caught my attention. It was unremarkable, right? So it's a good thing. So yeah, basically they found evidence that I'd had significant operations in my belly, and they could see some clips and they could see some sutures, but they expected to see them, so that's no big deal. Unchanged appearances of the known hepatic hypoattenuating lesions, right upper pole renal cortical hypoattenuating focus and bilateral renal cysts. Now, that means they were there before, they're there now. They haven't changed shape, they haven't changed size. We are certain that they are benign. We can still see them, but they're not changing, so everything's fine. It's the equivalent of having like a benign mole on your skin. Like we looked on your skin and we saw it, we looked 6 months again and we saw it again. It's exactly the same colour, exactly the same size. It's fine. No new liver or renal lesions, unremarkable appearances of the pancreas and adrenal glands, no portal vein, splenic vein or superior mesenteric vein thrombosis. The urinary bladder and prostate are unremarkable. No new peritoneal or omental nodule or masses identified. So there's, like I've got something new and interesting in my thyroid. My lungs are not great, but the cancer is actually fine. Now I've gone to page 2. No size significant abdominal, pelvic or inguinal lymphadenopathy. No focal destructive osseous lesions. So osseous is your bones. So nothing going on in my bones. Conclusion, no evidence of local recurrence or metastasis. The well-circumscribed and homogeneous left thyroid lobe hyperdense lesion is felt to represent a colloid nodule. Further characterization with ultrasound can be considered. I've looked up colloid nodules and they're really common and they're benign. So I'll have an ultrasound and we'll look at that, but no one is alarmed. So that's where we're at for my CT scan. So we'll just go back to the agenda now. Next steps. Okay, so the next steps are that I'm going to go and have an ultrasound on my thyroid, and I've been recommended for another 3 months. And after 3 months, I'll have another set of blood tests and CT scans. So those are the next steps. Now, the next thing on the agenda is the Rare Cancers Australia money. So it's quite evident from this that I am at the moment anyway, stable, I'm able to work, things are good. However, last time I requested donations, I was not in this place. I was very ill, I was financially struggling, and I didn't know what the future held. And I reached out to you and you guys sent me way more money than I expected. And a bunch of that money is still sitting with Rare Cancers. And I'm going to guess that you didn't donate that money so that I could earn an IT contractor's wage and still have someone else paying for my food and utilities and fuel. I'm quite sure. I don't need to ask you that. I know you didn't donate for that outcome to happen. So what I'm going to do is I'm going to stop drawing down on that Rare Cancers Australia money. It's going to stay there. Now, one or two things is going to happen in the future. Either, for whatever reason, I'm going to find myself unwell and able to work, and it may then be appropriate for me to start drawing down on that money again. But until that happens, it's not appropriate. The other thing is, I might actually never draw down on it while I'm alive. Now, if that happens, then that money will be used to pay for my funeral because, you know, I'm dying because of cancer, so that's reasonable. But there's still going to be a bunch of money, maybe $10,000 left over even after my funeral's been paid. What'll happen is Rare Cancers Australia will simply hand that or share that money out to other people that are on their books that don't have the ability to raise funds the way that I do. And I think those two possible outcomes are ways that you would be comfortable with your donation being spent. So I feel fine with that. I feel fine with that on behalf of you having donated that to Rare Cancers Australia. The other thing I'm going to do is I'm going to become, I guess, more generous with the donations that I make. Well, in a way, it's that you are making and I am re-gifting your money, if you want to think of it that way. When I see people that I believe have a genuine GoFundMe or a charity page or whatever, I'm going to become a lot more generous at actually saying yes to those. I don't always say yes to them just because there's so many, and some of the time you're not sure whether they're a scam or not. So sometimes it makes me stand off a bit, but I'm going to get more generous now that we're through it. So I think that's cool. Right, so lastly, please just subscribe and like. We're up to 25,500 subscribers, which is fantastic. I've ended up telling a story that's different to what I thought I was going to tell. I thought I was going to tell a story about dealing with what I was told at the time was an unavoidably terminal cancer, because that is absolutely what I was told at the start of getting PMP. Now my story is different. My story is actually that even if you're diagnosed with a PCI of 39 out of 39 twice, you aren't. There's a great chance you're not going to die in the short term. You might die in the medium term, but there's a really, really good chance you're not going to die in the short term. The survivability has come a long, long way since those survival stats that you're going to find on the internet when you Google it, just like I did when I was diagnosed. So if you do have PMP, if you're newly diagnosed with PMP, the message I'd like you to receive from me is it's more survivable than a lot of the literature online will lead you to believe. I even have a couple of people in my circle now who were, unfortunately, even having been seen by Professor David Morris, were deemed to be inoperable, and they were palliative. Both of the people I know that are in that boat are actually still alive. So it's not as absolutely dire as you think. It is definitely very, very serious. Your life is going to be permanently changed. But it's not as dire as the stuff on the internet will make you believe. So hang in there is the advice I'd have to all those newly diagnosed PMP people. And if you know someone that has PMP, please refer them to my page, and please say it's okay to contact me. You know, I will have a one-on-one Zoom call with you and talk it through. More than happy to do that. PMPPals.net is an American organisation that I'm a member of. They are a great help, so please go and join them. So overall, it's ended up being a story of survival. So yay for survival, and I hope you're surviving in your life. I know a lot of you are, because I've spoken to you on Zoom now, and there seems to be a bit of a common thread with people that are attracted to channels like that. And the common thread is that most of you have been through some kind of trauma and survived. And the reason that you're attracted to cancer channels is because you're trying to place yourself within that framework of survival within trauma. So hang in there, okay? Talk to you later. See ya.